being based here at Birmingham, you get a lot of exposure to major traumas, all varieties of patients that come through the door that we might expect to see on operations. So working here gives us great opportunity and great exposure so that when we do deploy, we've got the skills necessary to help our patients.
We are one team. I don't think that, the military is separate to the NHS at all. I never come in and feel like that. When we all work together, we are a team. That's something that I really enjoy because you don't always get that. So it is quite lucky to come in and know that the NHS are going to support you, we're going to support them. So it's nice.
No 2 days are the same working here. One day you could be working in triage and seeing all the people come through the front door and deciding who's to be seen quickly. Or you could be in the resus room with road traffic collisions, with people getting shot, people getting stabbed, which gives you great trauma experience for when you deploy. We've got a patient at the moment who's not very well. Just having lots of treatment and lots of observation at the moment. So I'm about to go and do a blood test in a minute, just to see what's going on, and I'll decide what treatment we need to be able to manage where we go. I joined in 2014. Before I joined the army, I was a postman, so it was completely, a massive career change for me. When you qualify as a nurse in the military, after a few years of consolidating and you complete your preceptorship, you can then choose to specialise in a certain area. So I chose emergency care, and part of that pathway is you go in a training margin for a year and you get supported to do extra university modules. So I've done master's level study through the military that they've paid for, and that's enhanced my knowledge in emergency care so that when I come in this department and work in any A&E that I work in, I feel that I have that extra level of knowledge and capacity.
So my career started in April 2021, so about 2 years ago now I've been in. Went to Pirbright, did my 14 weeks training, passed out. The day of my birthday I passed out actually, so I can never forget the date. And then I went to Lichfield, and that's where I did my healthcare assistant training and then got posted here in Birmingham. I've always wanted to go into care. It's been something I've always thought about when I was little. I always said I wanted to go into nursing because my mum was a nurse, so I've always been a caring person anyway, and I thought the best way to get into it is to start as a healthcare assistant, be good at what I'm doing, be amazing, know everything, and then go into nursing, which is obviously my dream that I want to do. So that's how I got into it.
Then you'll know.
What are you checking for, George?
So just checking his blood oxygen levels at the moment through the blood gas machine. Gives us a really good idea of how well he is. So it monitors the oxygen levels, your electrolytes like the salts in your blood, if you've had any like big traumas. It can measure hemoglobin as well, so the amount of blood you've actually got. It's a really good test. It's something we can do quickly in ED as well, that you don't need to send up to the labs and wait for. So most places like intensive care or ED will have them. One of the key skills for being an emergency care nurse in the army is that you are resilient, because potentially you could be working for a lot longer periods of time that you would be used to in an NHS or civilian setting, and you could be working in quite austere environments as well. For example, when I was deployed in Oman, we worked out of a firehouse. We set up a really small resus room, and we had about a 6 to 8 hour transfer time for a patient if we had to move a casualty. So having to hold on to people for a lot longer, which is probably something that working here prepares you quite well for with the way that it is in the NHS in terms of looking after people for a long time. And I think probably another important skill is having the assertiveness, because when you're deployed in small teams, you need to have a really good relationship with your team, but you also need to be able to stand up for yourself and stand up for the patient.
So the patient's just come in for a query stroke, so we've just done a plain scan, so I'm just scroll through some pictures. So this is just basically looking at if there's a bleed rather than a stroke, which would show up as bright white, but this is actually bone, so don't be disillusioned that that's all blood, that's bone, it looks different. Kind of round here is known as your circle of Willis. So you can see the contrast here that we've given, so all this white stuff here, this is the blood vessels, but ultimately it'll be the radiologist that will decide whether or not he's had a stroke, but it doesn't, at quick glance, he's not had a major one. But ultimately it's them that will do the report that will then go back to these guys, and then that will determine his management going forward.
I joined the army because I wanted to get paid while still training, and I know that if you join as a civilian nurse in the NHS, you have to fund your own way, you have to take out a massive student loan, whereas if you do it through the military, you get a living wage, you get your accommodation paid for, and you get a lot of support from the military as well as the civilian university.
I think it's making a difference to people's lives. Every day I come in and I see somebody completely different with a different condition. They come in with something that somebody else, has never been in with before, knowing that I've made a difference to their life when I go home, and that they're going to go home and they're going to be okay. That's what makes me happy when I come to work.
The military have been here for a lot longer than I've been in the military. We've got our own ward upstairs as well that's military led, and we've integrated seamlessly with the NHS staff. We've got really good relationships. We provide training for them, they provide training for us, so yeah, it's just a really good relationship we have. It's not just about doing the basic simple care stuff anymore. You're so independent in your role, you're really listened to by the doctors here, and I think being a military nurse as well, there's that expectation upon you to have that higher level of training and understanding.
I get to travel and do a job and be posted somewhere and help, whether it's humanitarian or a deployment. For me, that excites me, and that's what I want to do. I enjoy being in a NHS setting, but I like to have the opportunity to also get away and do something a little bit different as a healthcare assistant, which you can only do in the military. Coming into this job, especially unknown, it's a very challenging job. You're going to see bad things, you're going to go home, and it can affect you. Doing something that you love is rewarding, and no matter if it's a hard job, you're always on the go. It's going to be tough, it's going to be good days, it's going to be bad days, just like any job, I suppose. It's the highs that you take home when you've changed somebody's life or you've made their day. I think for me, that's what makes HCA, and if you can do that, no matter how busy you are, then you're always happy and you're doing what you love. I love that. It's great.
Being in the army really opens up a lot of opportunities that you wouldn't get as a civilian. A normal day as a nurse, it's a bit challenging. If I had not joined the army, I probably would not be doing the things that I'm doing currently. The proudest moment is becoming a military nurse.